Okay, thank you everyone for joining me today. We are going to talk all about chiropractic care for office workers and just those who spend a lot of time sitting. So, just to start out with some quick facts, on average, an office worker will sit for 10 hours a day. So, this is going to be during the workday and before and after. Specifically, remote workers spend on average 7 hours a day on a screen, compared to on-site workers that spend 5.5 hours looking at that screen. And then this isn't great news, but 69% of workers report working longer hours over the past year, including more nights and weekends. So we're not slowing down when we're working, it's just increasing in time. And all this sitting is linked to obesity, increased blood sugar, blood pressure, excess body fat, that unhealthy cholesterol, and all of these lead into increased risk of death from cardiovascular disease and cancer. So sitting is not great for our bodies. So first thing we are going to cover is just some common conditions. And this first slide is about upper cross syndrome. This is going to be pain in the neck, pain in the shoulders, often pain in the chest, and it's going to be characterized by rounding in these shoulders and then this forward head posture. And it's basically called or caused by imbalances in our muscles. So it's called like this upper cross. So you see this cross right here. It's going to be tight upper traps and then tight pectorals. So tight in our upper back and then tight in our chest, and weakness in our deep neck flexors, so the front of our neck, and then weakness in our lower traps and the muscles around our shoulder blades. And then this is really going to affect our breathing, which is something that I always stress to my patients. It doesn't look the best. So that's usually what brings people into the office. They're like, oh, my posture is not great. I'm just leaning forward. But it can really affect your breathing and just the effectiveness of your body systems up in your chest cavity. And then this next slide is going to be about text neck. So very, very similar to the upper cross. It's just kind of diving into that upper neck, chest, upper back area more. But it's going to be when your neck is in more flexion rather than extension. A lot of people like to say it's reversal of your normal neck curvature. And it's due to repetitive stress injuries in the neck, and then just extended forward head posture, often due to handheld device, so our phone use, but also our computer use. And then something that is a little bit jarring, but I also like to tell my patients is that your head weighs about the same as a bowling ball. And would you carry the bowling ball out in front of you with outstretched arms, or would you carry it closer to you? So that's your neck and your head can be like that bowling ball. We want the bowling ball over our spine. So our spine takes the stress rather than our muscles. And every inch forward that our head is away from our spine, it's going to be 10 pounds added weight that we're carrying around. So not awesome. So this prolonged stress can lead to inflammation of our ligaments, our muscles, and our nerves in our neck. And then just years and years and years of this can lead to arthritic damage. And again, that changing and that natural curvature of the spine. And then moving down a little bit, a lot of office workers come in with headaches. There are mainly two types of headaches that office workers will come in that will be related to their posture and to their work setup, their job. And these are going to be tension headaches and then migraine headaches. Tension headaches are going to be caused by pain coming from the muscles in the head and neck, usually due to posture and stress. These usually pop up towards the end of the day. And then it's going to be like a band like presentation. So if you're wearing a headband, along that band is going to be where you usually have that pain. And then migraines, it's going to be more of like a throbbing headache, often on one side of the temple. Sometimes it can be both sides, but these are going to be reoccurring headaches. Sometimes patients can have changes in their vision, they'll have nausea, light sensitivity, and it's usually due to screen time, sometimes a lack of hydration, sometimes there's some hormonal things going on, stress, but very common to presentations that patients will have. These next two conditions are carpal tunnel. So this is going to be numbness, tingling in the hand, and it's due to compression on the median nerve that comes out of our neck, down our arm, and into our hand. And it's going to be characterized by, again, numbness, usually in the thumb, your index finger, your middle finger, and a little bit of that ring finger. Often people will have like trouble gripping things. Um, they show up and be like, "Oh, I'm kind of having some clumsiness. I'm dropping things." And then they usually feel better when they do a little bit of shaking with the hands and kind of shake out that discomfort. And then this is going to be caused by repetitive hand use that aggravates the tendons in the wrist that cause swelling, often due to repetitive flexion. So bringing the hand down, hand positioning, that again can cause swelling and then compression on that nerve. Often, computer workers will have this and will be caused by unsupported wrist when we're working on those computers, and then just increases those tight muscles around that nerve. And then low back pain, very, very, very common. It's going to be pain in the low back. Sometimes patients will have radiation. So it's kind of that zinging numbness pain down the legs. You'll often have very tight muscles and then tight hips. Again, due to prolonged sitting and not a great work setup usually. Sometimes patients will put stress on their intervertebral disc. So those are going to be little jelly-like donuts in between the vertebrae and our spine. And when we sit, we put a lot of stress on those discs. So when we sit for years and years and years, we put all our weight on those discs and we kind of expel the water in them. So the discs start to dry out, our height starts to decrease, and sometimes that's when we can get some pressure on our nerves, and that's when we start to have that radiation numbness down the leg. Often, there's going to be an imbalance of muscles again in the body when we do a lot of sitting. So, usually a weak core, weak glute muscles, and then our back muscles and our hip muscles tighten up to kind of take over that pressure. So, it's really, really important to have a good supportive chair, and we're getting movement throughout our day. So, this is a very important slide. What can chiropractic care do for office workers? So, adjustments are going to be kind of your number one thing and what people expect when they come in for chiropractic care. But I always like to pair these adjustments with some exercises. That's where you're going to get the most out of your care. So, with our chiropractic adjustments, this is going to allow for full joint motion within our spine. When we do our sitting, often we'll get very specific segments that are stuck and don't have good range of motion, so they're not moving very well. And so with the adjustments, we'll put motion back into those joints, get those moving, but also with the adjustments, we'll release muscle tension, we'll get pain relief. And then when we pair this with our stretches, we help hold the adjustment and sustain the adjustment. And this is when we're going to get those good results. So with our exercises, we're going to strengthen those weaker muscles and when we're going to stretch and loosen our tight muscles. So we're going to balance the body with that. And then often we will do some craniosacral therapy and acupuncture with our patients. This is going to help balance out the nervous system and help with sleeping and stress, release that muscle tension. Often, a lot of patients are going to be in that fight or flight mode. And so, craniosacral will kind of de stress the body and again, balance out our nervous system. And then we can also pair with our adjustments, our stretching, our craniosacral, pair cupping, muscle scraping, and taping. So, with muscle scraping and cupping, we're going to bring new blood to the area, which is going to help with our healing. It's going to help rebuild our tissue that's been injured. And then taping is great to help with our posture. This is going to help and remind us of our proper alignment, but it's not going to restrict our movement. So I often will tape kind of your upper shoulder, neck area, and just remind you to bring your shoulders back, open your chest when you're not in the office and you're kind of sitting at your desk. And then proper desk setup. Let's see if my arrow will come up on here. Okay, great. So I always like to start with a chair. It actually is worth the money to invest in a really good chair, something that's going to support your low back in here and this lumbar spine. You know, if you have a chair and it doesn't kind of have that curvature in the spine, you can go out and buy kind of a lumbar support pillow. You can roll up a little towel to kind of set back here, but this is going to be super important and help with the alignment of your spine while you're working at your desk. Moving down here, we want our knees and our hips to kind of be at 90-90 and level. You can always add a little box down here if you need to bring your feet up to get that levelness in here. And then moving over here to our keyboard, we want the keyboard and mouse in line with our shoulders. And then we want our wrist straight. You can always add a little bit of support here with like a special mouse pad. But we want our wrist as neutral as possible and not in extension, so backwards or flexion forwards. Eyes should be 20 to 40 inches away from the screen, and then the eye should be at the top of the screen or slightly lower. And these are just some examples of some exercises that you can do at home, and it's going to be paired up for what exactly is your complaint and your diagnosis. So, starting over here, just like some book openers. Again, this is going to open up your chest. This is going to be good for that upper cross syndrome patient. And then chin retractions is going to be good for that upper cross patient too. And that text neck patient. But this is going to help strengthen those weak muscles. This is going to help stretch those tight muscles. Over here is some nerve gliding. This is going to be for that carpal tunnel patient. If there's any type of nerve entrapment going on in the arm, but this is going to help keep that nerve mobile. If there's any type of adhesion that's kind of clamping down on that nerve and giving you that numbness. And then down here is going to be that cat cow patient. This is going to be a great mobility exercise for any desk worker, but specifically that patient that's going to have that low back pain. And then just if you have any questions, please don't hesitate to reach out. This was a very brief summary of everything that we can do. And in the office, we will specifically dive in to your complaint, get you an exercise program to get you your mobility and your strength right, and then get you feeling better. So thank you so much for listening.